So,
It's a charade.
yes.
I don't know how many people.
I don't think so. I think it's very much.
They just recessed
Very
yesterday.
So they're gonna be back.
No, they broke it up yesterday. So if they were driving, they would be driving all day. They flew. They could be here.
This is our annual legislative and county commissioner update meeting. Obviously, you know by now that the governor called the legislature back in session early, so we will probably have a few to none from the Idaho legislature here today, but we are going to proceed. It's not a failure by any means because when it comes to important people, we already have one here today. Thank you for coming.
My pleasure.
So, the first, I would like for us to stand for the pledge of allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You may be seated. We plan to continue holding this event every year because we think it's important that whether people come or whether they don't come, or some may check in by some media mail, but we want to give the opportunity for county commissioners and legislators and other people to elected officials come and hear what's happening at Panhandle Health District and have some interaction with us. So thank you for coming. And I'm going to turn this meeting over to our director, Don Duffy. And he's pretty much going to be in charge for the duration of this meeting from 11 o'clock until noon. Mr. Duffy, you have the floor.
Great, thank you, Chairman Thompson, appreciate that. Senator Riggs, thank you so much for coming today. I know that you just barely got back into town from the session ending. I guess it was the 2021 session that ended, correct?
Yep.
We had to go back for a few days.
Longest ever.
I'm sure. Well, thank you so much for your service. And I do know Senator Riggs. He's good friends with Laura Whalen, and we had an opportunity to meet here a few months back prior to Laura's retirement. And we do miss her terribly here at the Health District. And so I was asked, the board asked me to take on that function just a few months ago, Senator, and just a little bit about me. I've been here at the Health District since 2014. And prior to that time, I owned my own business, very much entrepreneurial before coming to this job. And I've said this before, but I had sold my business to an East Coast company that wanted a West Coast presence. And I've been in healthcare my entire career, and anyway, I sold the company. My wife saw this job, and I said to her, "There's no way I'm going to have a boss or work without me." And but after coming and interviewing with Laura and some of our leadership, I quickly realized this is where I wanted to be. So that's a little bit about my history, just so you know. And I think you probably have a pretty good idea of our organizational structure. We have our district director, and then we now have 3 divisional administrators. One is Joe Rigella, who oversees our environmental services. We're kind of regulatory, that's where water quality is housed, and child care inspections and restaurant inspections, and all that. Joe will talk about that later. And then we also have our Health Services Division Administrator, which really is over like WIC and all of our health promotion programs. And Kim Young, over here, recently took that position for us. We're grateful for that. And then we also have a Clinical Services Division Administrator that oversees all of our clinics, home health services, and also epidemiology. And she is another new hire for us. And Jen will be joining us on December 6th to take on that role. So we're happy with that. We also, within our organizational structure, we have financial services where Christine Kremer oversees that. Our human resource services is overseen by Michelle Kenny. And also our public information officer is Kate right here. So, and then finally we have Jill as part of our executive team as well. She's our management assistant that keeps us all together. So, our structure, our goals here really is prevent and promote and protect. That's really what we do here at the health district. I kind of used the analogy, probably overused a little, is that, we try to be the fence at the top of the cliff and not the ambulance at the bottom of it. We do try to prevent some of these things, whether we're talking about water quality or health or senior services that we have. So I wanted to touch a little bit on that, but first of all, just on funding, because that's important right now. As you probably know, 78% of our funding comes from grants and fees, so outside of this area. For example, Women's, Infants, and Children, that's a $1 million grant we receive each year to provide nutritional food and counseling to young families. And so, again, 78% falls underneath that. We have our fees, which can come from clinical services, home health services, and also, for example, our septic tank system and approval system, there's fees that come from that. So 78% grants and fees, 11% from the state, and 11% from our counties. And as you know, with House Bill 316, that's going to go from 11% to 22% for our counties. And honestly, Senator, I'm happy with that. I like the idea of more local control with the services that we provide. And we're hoping that now that they will not have to pay for the indigent services, we hope the savings is such where it becomes a positive return for them. But time will tell. We'll see how those pieces all come together. But all in all, it requires the health district more than ever to communicate with our county commissioners and to make sure they know that we bring value to the community, just like any other business. That we're bringing value to each one of our counties. And I've taken it upon myself to begin visiting more regularly with our county commissioners. Had a great visit with our Cooney County commissioners last week, and to talk about our services and what we're providing so that they know we are bringing value to our communities. So I look at that as a real focus for us. And to kind of give you just a little bit of a snapshot, Senator, to the services that we provide. And most people are somewhat surprised by this, but in 2020, the Health District 1, so the 5 northern counties of Idaho, they touched our services 63,000 times in 2020. So a lot of people are taking advantage. And to give you a little bit of detail on that, we had 6,800 visits just in our home health program. This is where we go out to treat those with our registered nurses, our physical therapists, occupational therapists, get in the homes of these individuals to keep them out of the hospital, which is, of course, a significant savings and a much better lifestyle for those patients. And by the way, we are the only home health agency that will see you regardless of where you live, regardless of your ability to pay, and regardless of your acuity level, which is becoming more of an issue here. We have our clinical services that over 4,500 people touched those services in 2020. Our WIC program that I spoke of, we had over 6,000 individuals that touched that program in 2020. Our senior companion program and our Fit and Fall, all directed to seniors. The senior companion is exactly what it says. We become companions to these shut-ins. Our Fit and Fall program is where they can come and learn exercises so that they don't fall. It's an evidence-based program that we have. And I think the sociality of that is probably the greatest benefit that our seniors get. So we have over 450 seniors that have used that program. Our home visiting program, where nurses go into young moms with new babies and work them through that process. This could be a 17-year-old young lady that has a child with no support, no family support, no spousal support, where our RNs will go in and visit them. We made 1,800 visits to those individuals. Septic permits, over 1,400 in 2020, and it's much higher in 2021. So more to come on that. Of course, our suicide prevention work that we do, we provide free dental services for children. Our citizen review panel is about the foster program here in the state and providing feedback back to the state on how that's going. A wonderful program. And then, of course, our investigative disease, very typical public health, right? Kind of quintessential public health. We investigated over 1,100 diseases of the 70 reportable diseases in 2020. Something very important that we do. So I know that's a lot of information, Senator, but there is a lot that we do here at the Health District. And really, honestly, our goal in 2022 is to get out of the shadow of COVID-19, to bring these programs back into our community. We've kept them going throughout this insidious pandemic, and it's to really bring them out of the dark, bring them back to our public to make sure, and we're already seeing that happen this year. So we're very, very pleased with how that's going thus far. So with that, thanks for letting me babble on. I'm going to stop there. Do you have any questions before I turn some time over to Mr. Regallo?
Probably not a question, more of a comment on as he referenced the 316 and the funding shifts and whatnot. Obviously, there was a lot of difficulty bringing, people ideologically to the side of change of that scale because the kind of the planned obsolescence of the indigent and CAT funds because of the Medicaid expansion and everything that we should be offering. It was easy to say that mathematically this should work, but it's up to everybody to get together and actually make it work and function the way it's supposed to. And so we're still optimistic, but I'm staying very much engaged in the moving pieces of how this is going to function as we kind of get used to it. So if you see anything that comes up, if there's any questions or concerns about the funding shifts from the state level to the county level and how these things are going to take place, or especially given the COVID situation that we're still regrettably in, there's going to be maybe some growing pains that go along with it, and I'd like to head those off before they occur. So if you see something that might need to be addressed beforehand, please let me know as soon as you can, and I'm in talks with the governor's office and other folks to say, let's make sure that there are no kind of unintended negative consequences from trying to make this shift, and let's make sure that everybody has what they need to get their job done. So they agree with that point, and so we're going to keep working things behind the scenes to try to make sure that there aren't any negative impacts from this. So.
Well, Peter, I really appreciate having you as a voice on this. So I just do want to have a question on that, since you were one of the architects of this plan. So the 78%, the 11% that I mentioned, there is 11% that's still in statute that the counties will need to continue to fund, but the other 11% is not. Is that, do I understand that correctly?
Yes, and that's part of the, we can't mandate that they change their own, the way they have it written to the percentage that they're funding. We did work with the counties on this change. So, and that was part of it. That was part of what, and in politics, as you can imagine, when somebody sits at the table and says, trust me, we'll get it worked out. There's a lot of hesitation that goes along with that. But that was one of the things where when I started to get everyone around the table and say, look, none of this works if we don't put a little bit of faith in each other to make these moves collaboratively to get these changes done. And that's where we started to get kind of some, people looking around the table and going, okay, I'm still uncertain about it. This still scares me to an extent, but you're right. If we work together, we can get this done. And the counties said that they would make the commitment to make the appropriate statutory changes to fix the funding hole that would be left by the state. And they made that commitment. And so now getting to that point, once again, we still all have to rely on each other. And frankly, that's where I've also been staying in touch with the governor's office saying, we just have to be ready with any funding shortfalls that might come from certain counties that there are services that their health districts need more funding than the county is giving them because they're not holding up their side of the bargain, or they think that the health district can do more with less, or any of those situations. But I've been talking to the governor's office saying, let's just make sure that we keep an eye on potential funding support that health districts might need as we continue through this transition. And so we're all still optimistic that we can get the county representatives to, make the changes necessary to get the job done, but we're all working in support of each other to make sure that it actually happens.
That's great. And if I can ask you a kind of on the spot question, what guidance might you provide to us as a health district as we move through this transition? I've talked a little bit about us communicating more with the commissioners, make sure they see the value in what we do. Any other thoughts that you might have?
Communication is without a doubt the number one most important thing that's going to get us through all of this. It's making sure that that the right people are aware of the realities that are being faced by the health district and just the difficulties of dealing with COVID-related issues, but also the related impacts on other services that are caused by COVID. I mean, you talk about all the programs that you have that are completely unrelated to COVID, but they've got to have a huge impact on the way you do it and the people that need those services because of COVID. And these things are all tied together. And so making sure that everybody is aware of what's going on is I think, a critical thing. And I look at a lot of situations over the last year and a half where there were people that they had differences of opinions, but they weren't talking to each other to explain their side of things. They had different approaches, but they were just focused on trying to gather support around their approach instead of working more collaboratively in an all-hands-on-deck situation and saying, are there parts of these plans that we can put together and make a better, more robust overall plan? And I think that's something that you still see it in parts of the legislature. Saw it this week, where there are people saying it's got to be my idea that goes forward. Sometimes you've got two people with the exact same idea, almost the exact same language, and they refuse to, combine together to throw support behind one mutual idea. They want it to be their idea. And I think fundamentally that is not helpful to the citizens of Idaho. For me personally, I don't care about credit or work or, showing up in the morning right after I got home. That's not, I would have felt terrible if you guys had, put this all together and nobody showed up because it was difficult. So I made the effort to be here because I think these conversations are critically important. I think the more people we have discussing these issues, even if we are in complete disagreement on the issues, the more debate and discussion we have, the more insight we have on what is ultimately the best way to deal with these things. And so the more you can communicate, even when it's difficult, especially when it's difficult, the better we're all going to be in getting through this situation and establishing normal or the new normal or whatever that's going to look like. But we can't be afraid to have the difficult conversations and say we have to work together to take the best parts of any of these ideas and figure out how to make them the most workable for the people that we're all here to try to support.
So you might suggest that, we're working together to get me out to do, not just me, but our executive team out to visit with county commissioner schools, but that list could probably include elected officials.
Absolutely, absolutely. Because I think we're seeing more reliance on that community network of elected officials to work together for combined solutions than we have probably ever before. And so always, if this group would be willing to be one of the first to say, talk to us. Let us know how we can help you, even if it doesn't seem like it's necessarily in the normal course of what we do here at Panhandle Health. Maybe there's something that we can combine forces on and serve the community better. And when you start to have conversations like that, people go, actually, now that you mention it, there's this thing that I think that could really be helpful to supporting the community right now. And they're the ideas that we need right now that aren't had when we're too close to it with a group that we talk to all the time. It's getting out and kind of posing some of these thoughts to people that we don't have these regular interactions with. It spurs these new ideas that we need right now more than ever.
That's very valuable. Thank you so much. Before we move on to Joe, Mr. Chairman, Commissioners, do you have any questions before we go to Joe's presentation?
No, I don't, but I appreciate being able to listen to what Senator had to say. Very good. I thought we were here to give them some information that they come to give us.
Yeah, it's been more than helpful.
It goes both ways. I think it needs to.
Yeah, for sure. Mr. Riello?
Slide this up here a little bit. This all. This one, okay. Usually never being told that someone couldn't hear me. Not a skill I lack. Good morning, Senator and members of the board. I just want to take a few moments, and actually I'm going to slide this a little bit more so I can actually see. Just take a few moments of your time to give an update on the Environmental and Health Protection Division here at Panhandle Health. Basically, the next slide, please. Yeah, just go. It's cascading.
Oh, okay.
There's basically 8 major programs that fall into the environmental side of our division. And what is interesting is that we're seeing growth across all of those different programs. So obviously, food safety relates to issuing food permits for licensed food establishments. Well, the number continues to grow because our economy here in the 5 northern counties is growing. But where we see, I think, the largest realization of growth is in our septic programs and that involvement. Next slide, please. This slide depicts a 5-year period, and the numbers are really small, but let me just explain to you that in 2017, that'd be on the left, we were issuing 873 septic permits. In 2021, we've issued over 1,600 permits, and we're not finished yet. So what's interesting is the last couple of years, we have seen, because of the weather being good, we've seen septic installation going into the winter months. That's almost never done, but in the last few years, it's been done because there's such a demand. To give you an idea of the level of growth, 81% growth since 2017 in the septic program. And in the last year, there's a 34% increase in the program. We fortunately were able to go to the executive team and ask for some additional resources, but we certainly didn't increase our staff by 34% or by 81%. We increased it by about 8%. We have some efficiencies that we believe we
have built into the program, and we believe we can continue to provide excellent service for that. Next slide, please.
Joe, before you move on, can I ask you a quick question
yeah.
about that? Are most of these septic permits, are they in like truly rural areas, or are they in like places on the prairie where they just don't have sewer yet?
Yes and yes. But historically, in the last 25 years, the cities that annexed property, they brought a lot of development, mass development into city sewer systems, which is excellent. That's what we prefer. But the growth that we're seeing, to give you an idea, Bonner County exceeded Kootenai County this year for the first time we've been measuring digitally for 25 years. They've issued more permits in Bonner County than in Kootenai County, okay, because of the level of growth there. And specifically, not downtown Sandpoint, but around some difficult areas to put in septic systems around water. One thing I want to point out that we just found out is we are supporting, Panhandle Health District is supporting a change in the rule of the state of Idaho, which has some of the most restrictive surface water setbacks for septic in the country. Far more restrictive than California, New York, places where you would think it would be. And so we're supporting an initiative inside the DEQ process, in the rulemaking process, to change those setbacks and basically cut them in half. So right now, where you would have a 300-foot setback from water based on a particular soil type, the most restricted, it'd be dropped to 175. And we are very supportive of this. The science shows that would still be very safe and healthy for our streams and lakes. And so we're very happy to be involved in that. That just occurred in the last couple of days, that they've asked all the districts to weigh in. Next slide, please. So how do we measure our effectiveness? Well, I like to do it two ways. I like to take a look at the people that oversee our programs. For instance, in the case of septic programs, DEQ comes and audits us once a year. And again, Mr. Chairman, I'm proud to report that we are getting somewhere in the neighborhood of an A+ again, 97% for our basic systems and 96% for our complex systems. And this comparatively is significantly higher than some of the other districts get. They tend to be in the 70s and 80s. So we're doing a very, very good job, we believe. And I think when you correlate that with the customer service numbers that we're getting, and that's an average of 800 to 900 responses out of about 4,000 people or entities that were so it's a large sample size, and I believe ergo very accurate. We're getting a 95% approval rating out of our customers. So being graded from both ends, I think that says a lot about our team. Yes, sir.
I thought that as of a few years ago, the setback was changed from 300 feet down to 200 feet.
No, it's 300, 200, and 100 depending on the soil types. So if the soils are real sandy, real loose, it's going to be 300 feet. If it's in between, sandy loam, that's 200 feet. And then clay ridden, where there's a lot of restriction and flow, that's 100 feet. But what we're talking about now is it would be halves of those. So 175, 150.
I don't quite totally agree with that, but go ahead.
Yes, Mr. Chairman. I'll go back and talk to Eric again. Maybe I heard him wrong. Or maybe there was an exception for Benelux County, I don't know. The food safety program is one of those areas that instinctively you would think, oh, everything's fine. No, COVID had a huge impact. It had a huge impact because many of the restaurants didn't want someone from outside, even somebody from the health district, coming in and contaminating their operation. They were doing out service only. They weren't doing dine-in. And so, we weren't able to go and inspect, which deferred their inspection. Not because they were trying to get out of it, it made good sense from the COVID perspective to not have people coming in and wandering around their restaurant. What we did was we piled on it just as soon as we were able to, and we're currently, if you could click on that. Sorry. We're currently 80% of our goal with an expectation to complete 100% by 31 December, which is our technical due date anyway. Next slide. In the Silver Valley, we run the institutional controls program, and there's a bunch of words there, but I'll bring it down to, we make sure that you have clean soil to live and work in. And that's essentially our role in the team, working with DEQ, EPA, a variety of contractors, local, county, and city officials. But we are focused on clean soil. And so that's what the institutional controls program office does there locally. They issue permits for you to disrupt the soil. They also provide clean soil, clean dirt to you in a few yards of it, but it's provided free of charge and delivered to your
And this is in Shoshone County.
in the Shoshone County, but specifically within what's called the box, so the area that's affected the most by contaminants. Next slide. All right, we got everything up there. Blood lead screening is something I wanted to highlight. Usually we do about 350 of those a year. This year we were only, because of COVID restrictions and equipment failure, we were only able to do 119, which relates to 87 of the 0 to 6 year old group. That's about a third of what we normally do. And so we're hopeful that, number one, we're getting different machine carts, and it's very complex. There's the old machine and the new machine and different cartridges. And of course, what we had and what we wanted to get were mismatched. So we couldn't make the old cartridge work in the new machine. We will work on that, and hopefully, if our procedures allow us, because of COVID in the future, we're going to come up with a plan to extend the time period as well, so that we can open a broader base of time and get and capture as many blood lead screenings as we can.
What are some of the results you're seeing from the blood lead screenings that you're doing?
The good news is, and I'd have to go back and look at the exact numbers, but the good news is that we're not seeing an increase in any particular area. The childhood category 0 to 6 were good this year. However, maybe they were good because the sample size was real small. So, if you're doing 250 and you only did 87, then maybe you aren't doing as well as you think you are. So that's why we're looking at increasing the time period and then having some other procedures. I'd love to see us do 500 up there. It's really hard. We provide an incentive of, I believe, $30 or $40 to a family per child to have their blood screened. That does help in some cases, but I'd like to see the numbers increase, because it will give us a much clearer picture. But what we are able to do with each individual case is manage that, work with them, find a way to mitigate it. Frequently, it is not actual lead in the soil in their home. It's some anomaly that you wouldn't think about. The man's a painter. He brings his old windows and such home to sand and does that in the yard or in the basement, and they're all full of lead. And so the kids are picking up the lead, and he's picking up the lead from sanding windows. Get with him, figure out a way to mitigate that, no problem. Kids, we rescreened them, and that particular family, the kids were in great shape within 6 months. So, next slide, please. Public health preparedness, that's another area that we have. This has been tremendously important in the COVID response. This is where our incident command experts reside. This is where all of our planning and preparedness is done. This office does an incredible job with just literally a handful of people. One of the things that I'm most proud of, and I highlighted there, is we have 900 plus Medical Reserve Corps volunteers here at Panhandle Health District. And what does that mean? That means we've doubled that since March of 2020. We had about half of that number. And in the period, we've had over 22,000 volunteer hours. It's actually larger than that, but that's a number I can use that I can show everybody because it's finished calculating. And that equates to 11 full-time employees and over $1 million in savings because their volunteers were not paying for their services at all. And this includes medical doctors, nurses, therapists, and a variety of other folks who are just rolling up their sleeves and helping. So that's just a snapshot of environmental health. Your questions? Thank you.
I asked all mine during the presentation.
Best way. The slides there. Thank you.
Well, thank you so much, Joe. Appreciate the tremendous work you and your team do. And Commissioner Filios, it's happy to have you with us.
Thank you. Sorry I missed it. I had 11:15 appointment for my booster.
Excellent.
So,
Well, thank you so much for being here. And I think are you acquainted with Senator Riggs?
Yes,
here?
sir. Absolutely.
Okay, very good. Excellent. Well, just moving through, the next item we wanted to talk about here today is just talk a little bit about this opioid settlement that's coming. What an event this is. It's a $26 billion settlement from right now with Johnson & Johnson and 3 other distributors, with $120 million of that coming to the state of Idaho. And we understand that 40% goes to Department of Health and Welfare or to the state, 40% to counties and cities, and 20% to the health districts. And we also understand this isn't the end of the settlement. There's some thought that it might actually double as more and more of these lawsuits are settled. So, regardless of how you feel about that, one way or the other, it does help us to move along the wonderful work that we've already done. In fact, I can comfortably say Health District 1, Panhandle Health District, has led the way throughout the state, meaning through other health districts in this work regarding substance use disorder. And in fact, when the state, when we heard about this settlement, they gathered information from the health districts of how we should be using those funds. What I'm saying is when this settlement goes out, what are the list of services that you could use these funds for? The Attorney General's office, who put that together, used much of the work that we're already doing in substance use disorder. So we're very excited about that. Preliminary numbers coming out right now is showing that the health district will be receiving roughly $193,000 a year for the next 18 years, and that's not including other settlements. Also, what's interesting about this is that counties will be receiving funds, and our estimates for Kootenai County is around $150,000 a year, and I emphasize estimate. And the counties will have the option of allocating those funds to the health districts if they wish. Either way would be wonderful, and so that's just an option. We do have a deadline that's approaching, however. It's right around, I believe, the 3rd of December. The county, cities, and the health district must sign a document that we want to receive those funds. And it's that document as well as a document that we will relinquish any other lawsuits that we might have toward these opioid distributors, which we've never had that as a health district. So, so it makes that an important item, and it will be an item on our Board of Health meeting today, an action item of whether or not we wish to accept those funds from the perspective of the health district. So I've asked Kelsey Orlando to come to talk a little bit about the work that we've done and how we might use these funds if we were to receive them. Certainly, Kelsey has led the charge. She is the subject matter expert in the state regarding, as it relates to health districts, regarding substance use disorder. A lot of great work has already happened. We're in the middle of a $1 million HRSA grant, already moving this work forward. So it's very exciting, and I see it as a district director as this becoming a major program of public health going forward. So I thought we'd give a little update on that. So Kelsey?
Thank you, Don. It's all right, I'll make sure everyone has a handout as well.
Thank you.
I got one.
Thank you.
Well, hello, and thank you, Mr. Chairman, board, and legislators for the next minutes of your time. So I am here to share about the current nationwide opioid settlements, which Idaho has joined in an effort to bring solutions to the ongoing public health emergency. Because of the direct effects the opioid crisis has had on North Idahoans, I'm here to ask you to have your county commissioners sign on to the allocation agreement and to encourage their voluntary reallocation, which puts faith and fiscal management on Panhandle Health District to continue our leading role in responding to this crisis. On page 2 of your packet, you will find a synopsis of our quality public health work starting in 2017, where we began our efforts in clinics and pharmacies and ending with future goals for the evolving problem. So our work began responding to the severe overprescribing of opioids that was taking place. According to our Idaho Board of Pharmacy data from 2015 to 2017, there were annually 94 opioid prescriptions dispensed per 100 people in our 5 northern counties. That's a rate nearly enough for every person in the entire population to have a bottle of opioids, where the average prescription length was 2 weeks. In retrospect, North Idaho was an extremely vulnerable population to be targeted by opioid manufacturers due to the hardworking loggers, miners, and other manual labor force our frontier area is built from. Our rural workforce has a higher susceptibility for workplace injury, chronic pain, and in turn were the victims of the overprescribing that was sweeping our rural communities in the early 21st century. In 2018, our public health response again shifted from being solely provider-focused to have a full community-wide approach. The North Idaho Health Assessment, or Community Health Assessment, identified substance use as a top 3 health priority of the public because pills and soon-to-be heroin were being sold in every facet of our neighborhoods, including school lunchrooms, with high-level professionals, and in local bars. This changed the face of the opioid and heroin addiction to have no identifiable qualities. It could potentially affect any person and any family, regardless of socioeconomic status. We quickly responded by hosting the first North Idaho Prescription Opioid Solution Symposium. 100 professionals showed up to hear from local specialists and engage in the creation of our locally developed opioid strategic plan. This plan used 4 pillars of intervention, which has continued today as our framework to address opioid use disorder. This includes prevention, harm reduction, access and awareness to treatment, and community resources, which has evolved to have a recovery focus. By 2019, the progress and commitment from our community collaboration put us in a competitive position to apply for federal funding to reduce the morbidity and mortality associated with our local opioid use disorder. Securing this award increased our capacity to address substance use disorder by piloting best practice models. In our innovative approach, we've deployed multidisciplinary strategies which have evolved the partnerships of community agencies, ranging from school officials, law enforcement, and medical professionals. We've continually addressed needs and gaps in prevention, treatment, and recovery through proactive solutions personalized to our community. Our current work has an expanding partnership with public safety, as you see on page 1, to address the shift in illicit substance use and the public harm fentanyl is causing to our area. Our success is visible in our recent launch of ODMAP, Overdose Detection Mapping Application Program. This DEA-run service provides a real-time alert when an overdose occurs. And we became the first health department to successfully be involved in bringing this service to an Idaho community. And in the first weeks, we were able to detect a supply that was harmful and dangerous, linked by a string of overdoses. Addiction now poses the greatest threat to public health and public safety because of the lethality of substances on our streets. Our team at Panhandle Health has identified community champions, frameworks of success, and has big dreams of the possible outcomes we are not only equipped but prepared to lead. Our future decade addressing substance use disorder will focus on the promising practices found on page 4, which include leveraging community partner relations, establishing strategic goals for meaningful impact, evaluating the surveillance and response to critical populations affected by substance use disorder and mental health conditions, leading cross-system coordination to reduce overdoses, and supporting public safety and criminal justice in evidence-based solutions to reduce death and recidivism. We're eager to continue to be trusted by you, our elected officials, and our community to lead the North Idaho response to the opioid crisis by implementing these promising practices the upcoming opioid settlement has outlined. By you encouraging the signing of the voluntary allocation agreement, you help us keep our promise to make North Idaho a healthier community. And Mr. Chairman, if there are questions at this time, I'd be happy to answer.
Questions?
I have one.
Yes. Thanks.
Looks like the health district started this program in 2017. How's it been working? Are overdoses up, down, the same?
You know, we've seen a huge change in the landscape of what the problem is. When I think about how safe prescribing has evolved, we know so much more than we did in 2017, and our rates are decreasing. That 94 prescriptions per 100 people has decreased. We don't know why those prescriptions are getting written, so we always keep, some grace period of people that have non-terminal cancer, palliative care. Opioids have a time and a place with those patients. It's for some of the more acute and the chronic situations that we want to make sure our providers are using integrative care, physical therapy as a first line. So overdoses are increasing, which is challenging when our goal is to have them decreasing, but the lethality of substances is different than it was in 2017, which is why we've continued to change our approach. We have things like naloxone or Narcan available to the public now, where we're able to get that life-saving drug into the hands of people who might see an overdose or experience an overdose themselves. We're able to also have a more realistic look in surveillance, and so that we can respond more timely. ODMAP has changed our ability to know what's happening in the community in regards to overdoses. And in a month, we were able to put a public alert out, and we're about to be able to have the most clear understanding of a month-over-month overdose rate that we've ever had. So it's working that we're reaching the community. It's challenging that the problem shifts almost on a daily basis, which I think public safety would agree with.
And if I could just, I think just to echo what Kelsey was saying, when we started off, it was about providers giving out opioids. But then the target changed. People were getting fentanyl over the mail. So we've adapted, we've pivoted to address that issue. And that OD map is an example of that. So it's challenging to say the least. Thanks, good question.
I have one kind of unfortunate and unpleasant question. It's a reality of the difficult situation that everyone here is forced with facing. The more doctors that are prescribing legitimate opioids means the less people are getting, unbeknownst to them, fentanyl-laced versions of it, triggering overdoses, things like that. Have you seen any sort of correlation between decreases in doctor-prescribed opiates with an increase in, people trying to get similar street drugs that are laced with fentanyl and having kind of more serious overdose reactions because of that?
To clarify some with fentanyl, it's just it's a new complex challenge. Fentanyl is a prescription drug. It's again, has a very legitimate reason that it's used. It's getting laced into every substance out there. It is laced into marijuana and into the vape pens. It is in methamphetamines. It's in pressed pills. Of course, all of those are illegal substances. So, if I'm hearing, or to try to answer your question, legitimate prescriptions aren't going to be laced with things that they're going to know what they're taking. The challenge is a business model. If you could sell, if you could have one box of something or 100 boxes and need to distribute it, what would you choose? From a business model, you're going to choose that one box, and that's the potency of fentanyl. So we're seeing it on our streets because it's cheap, it's easy to get out into the community, and people are starting to prefer it as well. So it's just kind of its own evolving beast that requires different treatment models, different drugs to provide treatment, different levels of life-saving mechanisms to return someone from an overdose, and a lot of education. People have a lot of fears around fentanyl that, our job as public health is also to help law enforcement know, what is the actual danger around fentanyl. If you hug someone and it's on them, you're not going to overdose from it. But getting that information out is really challenging. I hope that answers your question.
No, that's good, thank you.
Kelsey, thank you so much. This, I am sure there's individuals that the doctor said, I'm not going to give you anymore. They go find some illicit source for it. I'm sure that that's happening. One of the things that in the research that we've done, which we will take advantage of this when we get additional funding, is the idea of build it and they will come. The idea of building a treatment center, they will just show up. People will want to do that. We have seen in other organizations that's just not true. They'll build these treatment centers and nobody shows up. Our attitude is build it and go and find them. And that's one of the benefits of this new funding is that we can do that. We have just recently signed a lease agreement with a company called Ideal Options that will have a treatment site at our office one day a week in Shoshone County and one also in Bonner County. And where they will go and find those individuals and bring them in and get that treatment that they need. So again, it is a changing landscape. That's something we just can't ignore. Kelsey, thank you again. Any other questions? Well, finally, that really covers our agenda today. I wanted just to talk briefly on, just some of the challenges that we look going forward. One of the big ones we face right now is the staffing, is the issue of finding staff. We continually lose people to much better paying jobs than what they have here in Panhandle Health District. And that continues to be an ongoing challenge. We continue to evaluate our pay scales to make sure that we will get the people that we need to work the important programs that we have. So, and I see this problem continuing through next year. I think this year, when we put our budget together to present to our board, it's going to be very interesting. And we've got to continue to be efficient, and at the same time, we've got to be able to find the staff that we need. In a report I did recently, we currently are doing quite well. If we look at revenue generated by FTE, we're $10,000 higher than the average of health districts around our area. So we've done a great job with that. So we continue to look at that as a performance standard, and staffing continues to be a challenge. Of course, House Bill 316 and that transition, it's not just the challenge of the funding change, but also the independence that we now have. I think we've always had it, but now it's clear in statute that we have it. And so we could have a whole new HR system here. We may not even be using the state system anymore. That's a big transition. And at the same time, we have LUMA now coming into the state, which changes the way we report things fiscally and also in HR. And that's going to create a big change for us. All good things, but the change is going to be a challenge for us, I'm sure. And just the last thing I want to, just a plug for North Idaho and particularly to you, Senator Riggs, and is making sure that North Idaho gets their fair share. For example, with this opioid funding, of that 120 of that percent that's going to the health districts, it was a measly 14.5%. Where down south it's nearly 50%. And yet we have the program that's really leading the way on substance use disorder. Our home visiting program, again, our nurses going out. And for whatever reason, that funding was cut, some of it was cut so that other districts could get the funding, even though we were well ahead on that program. It's almost like we're penalized for innovation in some cases. So I don't want to sound like I'm whining. If I do, I guess that's fine. But I just want to make sure that we get our fair share of that funding that's available. And just wanted to point that out in closing. And that's the end of my agenda. So thank you for letting me.
I'd like to quickly ask our commissioner here. He's just talked about the employment issue. How is it on the county level here in Cooley?
We currently have 72 job openings.
Is that all?
Yeah. Well, out of an employment base of about 850.
Right.
We do have turnover. Some departments will run close to 20%. It just really varies. The biggest challenge that our turnover has actually been lowest among law enforcement, so that's probably a good sign. Where we have particular challenges is in our community development, which is planning and zoning, because they're highly specialized functions. And we are currently operating on a 3-month backlog on residential building permits. In a normal situation, we're running 2 to 3 weeks. There are reasons for that. Obviously, the growth rate. The other part of it too is that a lot of the submissions that are coming in from engineers and architects are frankly getting rather sloppy. And so our permit technicians are having to look at them and go back to them. And unfortunately, the people, the residents who are contracting to build these homes aren't seeing the interaction that goes on between us. Other departments, it really just varies, but we do have 72 openings right there. Countywide.
Thank you for that on the spirit. You're very welcome. Okay. That concludes our meeting. Thank you, Senator, for coming. Thank you, Commissioner, very welcome for coming. Appreciate having you here. And we're going to, our plans are to continue to have this meeting to invite our elected officials here so we can do just exactly what we've done here today, only maybe on a bigger scale with a few more people.
Oh, and Mr. Chairman, if I could just add one thing. Our law enforcement have historically been on a pay matrix. And this year, this fiscal '22, we finally instituted one for the general pay plan. So all our employees are now on pay matrix, so they can see what their progression is through the matrix. And really, this was done, it's almost groundbreaking for us, but we did that in an effort to stem the turnover.
Good.
Thank you.
Thank you. Thank you so much. All right, well, we are adjourned. Jill may have some lunch for us, get somewhere, I don't know.